Okay, and we are coming back. I am Skip Murphy, joined by Brockster Mike, Brian Bulldog Tilton, and obviously Dr. McCoy.
I always get this wrong.
That's all right. You get your politics right, so it doesn't matter.
It's spelled long and spoken short, like the Hatfields and McCoys.
I know. With a name like Murphy, I should be able to say
Yeah, and we got full tilt Bulldog right here.
Yeah. So let's pick up where we were, and obviously Obamacare.
Well, we were talking about what's happening in Washington. We're talking about what's happening in Washington right now, and most Americans, unfortunately, have been deprived of the information they need to know exactly what the House is asking for. If you read the newspaper or listened to the major networks, you'd think that the House was asking for a total abolition of Obamacare. What they have asked for is two very modest things. Number one, since the employer penalty has been delayed for a year, the employer mandate, let individuals decide whether they themselves want Obamacare. And if everybody who wants it can sign up, it's not going to be delayed. But if you, as an individual, don't want it, you won't be slapped with an IRS penalty. They're only asking to delay the penalty for a year. And secondly, they're asking to get rid of that illegal subsidy that was weaseled by the president for members of Congress. The law says that members of Congress have to enroll in the Obamacare exchanges, on the thinking that what's good enough for the public ought to be good enough for our members of Congress. But the politicians got cold feet and said, well, it's not affordable for us, even though it's called the Affordable Care Act, so we want the government to subsidize our premiums on the Obamacare exchanges, even though members of Congress earn $174,000 a year.
Well, I actually thought that part of the argument was that it was the congressman's staff that couldn't afford it, because of course they're not paid as much. In fact, some of them I think are paid very poorly indeed. And so
maybe by Washington standards, but not by what the rest of the nation.
Absolutely.
They're earning hefty salaries. This is like Kuwait. You go to Washington D.C., it's like Kuwait. The restaurants are incredibly lavish. I've never seen anything like it. Washington has become the Gold Coast of the Western Hemisphere.
I would like to return it to the swamp from which it came, but that's but that's another story.
A glass of wine is $20 at least in Washington.
Yeah, just about.
Just like any other artificial capital in the world needs to be overtaken. Brasilia needs to be overrun by the jungle. Canberra needs to be overrun by sheep, etc.
So, but I thought I was radical.
He is getting more and more
determined. It's this demand to eliminate the subsidy that's really holding up.
Exactly, and as I say, it's the staff. And here's my thought on that. So you need a subsidy because you're not paying the staff enough to be able to afford this affordable care. Well, you know what? The hell with the subsidy. Employ less staff so you can afford to pay it out of the allowance you've already got.
Mike, I almost always agree with you, but it's not the staff. I had 4 members of Congress on my radio show last week when I was standing in for Laura Ingraham, and I asked each one of them politely. No one would commit to giving up the subsidy. Not one.
No, it's a perk.
It's disgraceful. There should be a roster of shame, and the name of every member of Congress who's taking that subsidy should be on it.
And I'm going to start with the first 2 names, Carol Shea Porter and Annie Custer. Yeah, there they are. Annie Custer was quick to send out an email at midnight at the beginning of the shutdown on Monday night to say this is the Republican Party shutdown of the federal government. She has been dead silent ever since. She's developed a case of political lockjaw, not talking about the cancer patients that are not being funded, that the Harry Reid says, why would we want to do that? She's dead silent on that. She's also silent on these subsidies. She's taking those subsidies, and why not? She doesn't pay her property taxes on time.
Should get any subsidy. If it's good enough for the public, it's good enough for Congress. And if it's affordable enough for the public, it's affordable for Congress. I can't believe they even have the guts to look into the TV camera and admit they're
Well,
taking
Betsy,
the
let's talk about what this subsidy is.
you-
This is a subsidy for members of Congress who make $175,000 a year, and we're subsidizing 75% of their insurance premiums. The gold plan, they're
Yes,
only
the
allowed to
gold plan.
take the gold plan, as
Right.
Betsy pointed out.
Yeah, the great unwashed public can take the silver and bronze plan, but members of Congress, they have to take the gold.
But if you're
the bronze
making
plan gives you-
$50,000 or $30,000 a year, you get very little in subsidies, if anything.
And you get to choose the bronze plan, and you suffer from it because you get less care for more money.
How about the bronze plan has a $5,000 deductible? You never see a penny of it.
Wait a minute. I thought the Democrats wanted to outlaw high deductible plans.
Oh, no. Maybe they did, but the president wanted the premiums to look low, and he actually judged the public stupid enough to think if the premium was low, they wouldn't bother to look and see what the deductible was.
Well, that's and in fact that's what we're
Yeah.
seeing all the time now.
Right.
In that the cost of this is almost like the FSA, the healthcare.
Well, the
accounts
FSAs
that you
and the
could have.
HSAs is the same thing
Same thing.
for
My
the
son has
employers
it.
to make it look affordable.
Well, in a lot of cases, my son has one, and it works very, very well for him. Very low premiums,
Yeah.
high, middle-sized deductible, but he's contributing to that to the point where he can get rid of that deductible because he's got the cash in his account.
Well, and by the way, the government isn't forcing them. This is the issue, forcing young people to buy these plans. It's unconscionable.
And driving up the cost of this too, because what we're seeing right here in New Hampshire, don't forget, Anthem just said the other day on October 2nd before the legislature, their individual policy premiums are going to go up 30 to 50%. This is after the governor, Maggie Hassan, approved the Anthem plan that cuts 50% of the hospital and doctor providers in this state, and they did it in secret. And what they are saying now is, oh, well, we're looking at a 30 to 50% increase when we were told just a couple of weeks ago it was going to be a 15% increase. And that's on the individual market.
Right.
Forget what the group market is going to be.
It wasn't totally secret. The news on that came out sometime in September that Anthem and Blue Cross are going to cut about half the hospitals and providers.
And it's happened in many, many states.
It happened.
yeah.
It
It's
happened
another
in Missouri,
way
I
they
believe.
kept the premiums lower.
Anthem are turning out to be the bad guys.
California, everywhere they've done it.
In state after state,
Yeah.
where they're cutting all the best providers because they can only, owing to the restrictions of Obamacare, they only afford to keep the cheapest. Anyway, I was going to say something even more radical. Put the radical hat on for a moment, and that is, let's stop paying Congress and their damned lackeys altogether. If you can't afford, to take the job and be a citizen legislator based on the money that you've earned as a successful citizen, you damned well shouldn't be there.
Right.
Now here's the other thing that's scary, and I bet you know about this. In San Diego County, there are 209 general practitioners. You look at the general population, that works out to be slightly 15,300 odd people per physician. As they are going towards the Obamacare there, they are starting to go, oh crap, look at all these people and not enough doctors. They are actually going to put agents out into the doctors' offices to say, are you doing everything that you can? Are you working to capacity? And think about that now. The progressive is going to say, we need to take care of these poor people. They're willing to take a doctor who, for whatever reason, decides, I only want to take half the number of patients that I could because of either I'm not feeling well, I'm financially already well off, I don't need the stress, yada, 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 for whatever reason. It should be up to them to make the reason. California's now going to go and start asking them, demanding them, why aren't you taking more patients?
Right.
Now, I had that happen here in New Hampshire. When
It's
we ran-
unconstitutional, though. The government cannot force you to work.
Well, no, they can't. So they're going to stop working altogether. And as Walter Williams is at great pains to put it, you own your body and your labor, and anybody who attempts to make you work for their purposes or for other people is in fact putting you into slavery. And he can say it. He says it with great conviction.
Let me draw another parallel for anybody who doesn't understand. The eminent domain case of Kelo versus New London. As Sandra Day O'Connor wrote in the dissenting opinion, she says, while people are safe in their houses, the houses themselves are not safe.
And I
It's the same type of thing.
Well done. Right.
And I applaud Sandra Day O'Connor because she was on the right side of the law on this case. Damn it, it's your property and they can't take it And
But that's what our bodies are. Our bodies and our healthcare decisions, that's us. That's our properties. And that relationship with our doctors is not something that the government should be in the middle of.
And this is what we really need, is a flaming dose of libertarianism going throughout this country, because it really gets down to those basic questions, which is what I do at GrokTALK. What are the basic principles? And I must sound like a broken record all the time.
Well, you know, one of the reasons that we can reach even across the aisle on this one is that, as I pointed out earlier in my remarks, it's shocking to me to recall how many times the left-wing feminist groups, Planned Parenthood, National Organization of Women, went to the barricades to prevent the federal government from looking at their healthcare records or dictating to their doctor. And now they're supporting a law that does both. Under this law, even if you have private insurance you paid for yourself, the federal government is still going to be dictating how doctors, including your doctor, treat patients.
It shows you how much further left that Overton window has shifted. And it's going to continue to shift over more and more. For those that don't know, look, OVERTON, it's basically what is the frame of reference for an entire society and how it views itself.
It's a sliding scale of the range of an argument or of a discussion, and it's gradually moved from individual responsibilities and freedom towards a more statist point of view, and the left keeps nudging it and the right keeps letting their end of the window slide. The phrase was coined by one of the professors at the Mackinac Center in Michigan, if I'm not mistaken.
Yeah, and to Betsy's point too about Planned Parenthood going to the fences and to the walls over these records and privacy and the like, Planned Parenthood of Northern New England is the navigator for Obamacare in New Hampshire.
Oh yeah, and you look at all the other places. We're seeing a reconstituted ACORN.
Yes.
What is their process? They are community organizers on their socialist model.
This is a way of permanently funding the allies of the Democratic Party and tilting the scale against a fair two-party system.
How are these navigators paid?
Federal government.
In some states it's the state government, but after the first year, this is the key, after the first year, they are actually paid out of the premiums collected by the exchanges. So that every time you write your premium check, you're funding Planned Parenthood, SEIU, AFL-CIO, NAACP, all of these navigators.
And of course, the remnants or renamed pieces of ACORN.
Right.
Oh, by the way, our members of Congress, that they'll be able to get their subsidies on the exchange, Annie Custer and Carol Shea Porter will not have to buy the health insurance through the federal partnership exchange with New Hampshire. She gets to do it through Washington, D.C.'s exchange program, and so does every member of Congress. They don't have to go back to Nebraska and buy the policy through that state's exchange. They don't have to do it through anybody else.
So they're not suffering through the lack of access to the best healthcare providers.
No. There you go.
Well, the other thing is that there's been some efforts to make sure that they don't backdoor it and put like a little health clinic in the bowels of the Capitol building.
Right.
Which is another thing that we have to be on the lookout for. And this is what drives me crazy, guys. I can't keep up with this all.
And it's
the perks, the private elevators,
just all
the
of
private
these
gyms, the private parking places at the airport. They all ought to be ashamed. Whatever happened to the concept of the public servant?
And that's the public servant is rapidly, if not completely done now, the public master.
And
that's the problem.
And precisely why I say ashes to ashes, dust to dust, Washington swamp. Let's dump it.
Okay, Doctor. I want to say thank you very much for, again, coming back, talking to us.
I want to congratulate you two on what you do, because you really are a national resource. You raise the right issues, you have the right guests.
We need to have you in on Saturday mornings. Come on over.
We'll buy you the coffee, the donuts, and the hot dogs.
All right.
Thank you very much for spending more time with us. Guys, at this point, we are going to say goodbye from the New Hampshire Federated Republican Women's Meeting. We are done. We are well overdone. And thank you all. And folks, I'll be putting this up later on. Thank you.
And I want to just say on the record that there are at least 10 Groksters, and we all contribute, and it's usually Steve sitting in this other chair here, but I'm very happy to be here today.
All right, take care, folks. Cool. All righty.
Grok TV.